Our responsibility is with that person, not the insurance company, not our convenience, not something else. We really need to be just doing what's best for that patient.
Let's ditch the quick fix and dive into today's conversation. Welcome, everybody. I'm joined today by Dr. Clayton Hansen, and he is the founder of Hansen Health Solutions in San Antonio, Texas. His multidiscipline practice focuses on a new wave of healthcare that veers completely from traditional medical approaches. Dr. Hansen's vision for healthcare includes alternative integrative options at one location to have the best potential to provide great care for his patients. This includes nutrition, physical therapy, ozone, IV therapy, hormone balancing, genetic testing, regenerative care, functional wellness, and health coaching, as well as chiropractic care. Dr. Hansen is also very committed to his own personal health and fitness. He trains and competes in ultramarathons and other high-intensity exercises. Dr. Hansen believes quality relationships to be the best investment. So welcome, Dr. Hansen. Thank you for joining us today.
Hey, thanks for having me.
I'm pretty excited to have this conversation with you. We both share a foundation in chiropractic, but you have definitely opened up your practice to really include great options for your patients, as I just shared. So what's the current status of your practice and what you're doing?
Oh, current status. Yeah, I'm really excited about what we do. We were just chatting about this just a little bit before you started recording, but I kind of ran into a problem in practice when it was just me, where patients would say, hey, Dr. Hansen, you're my doctor. Tell me what to do. I trust you. And that was all great, and I appreciated that, but I couldn't 100% deliver on everything because of my licensure. So it was very important for me. I saw very quickly that I needed to bring in full medical licensure into the clinic so that we would have the ability to not change our paradigm, but change the content of what we were delivering. And so that's when we really picked up things like the IV therapy, the functional medicine, the ozone therapy, these sorts of things that we do. And for me, I'm really just excited about I would say two things in particular. One, the content of healthcare, which are kind of that kind of list of services, but then also the system of healthcare, which is how all that happens. What are the relationships like? What's the process like? How do you make your decisions as far as what you're doing and why? There's a lot that I think is to be desired as far as the system of healthcare goes. And I think as providers like you and I, who have this great paradigm that we want to use, I think we need a system that models that paradigm. And I think for a lot of providers, we kind of get pulled into just kind of a natural, we're going to do it exactly how conventional does it, just with natural stuff. And there's a little discrepancy there that I think isn't allowing us to quite be as powerful with our practices as we could be.
So as a patient comes into your office, do they kind of have the exposure to all of the professional opportunities that are there? Whereas, and sometimes in the medical community, you go in and you just have that one doc, or even a chiropractor's office, you just have that one discipline.
I would say that's one very important thing, is having the kind of the team there, the team approach, as opposed to just sitting down with one provider. So as an example, one of the big problems that I see is in kind of conventional medicine with the system is that a lot of patients end up being kind of the go-between between different doctors. And so what this looks like for you and I is we sit down and the patient says, oh, well, Dr. So-and-so told me this, or you said to do this thing, but I went and I saw them and they said that was wrong. And they said I should do this instead. Or they just say, you're telling me this, they're telling me those things, they're telling me this, and now it's just too much because I've got 5 lists of things that I need to be doing. So this is a really bad way. That's conventional medicine, which leads you to conventional outcomes. And with our paradigm and a really healthcare, wellness-focused approach, we need to change that dynamic as a part of the system of healthcare. And so for me, it's very important that the patient is out of the middle and that I'm communicating directly with other doctors about patient cases. And so if a patient says to me, well, Dr. So-and-so said this, my first intention at that point is, okay, thank you so much. How do I get a hold of this doctor? How do I talk to them directly? How do we get the patient out of the middle of it? Because that's not helping anything. It's especially not helping the patient. I mean, that's a horrible position to be in. And what's tricky there is it's hard to get a hold of doctors, especially in conventional medicine. Good luck,
Right.
The patient says, my cardiologist said this. Like, I'm never going to talk to that cardiologist. That cardiologist doesn't care and they don't have time, right?
Right.
And nobody's paying for that. So there's no incentive. But in our facility, this is one of the reasons why we kind of bring in a group of people. And I think it's very powerful that way, is that person's just down the hall, or or we have a weekly meetings and we all sit down together and say, hey, Susie was asking about this. She's not clear about how we're coordinating. We need to do a better job of coordinating and then communicating in a singular voice to this patient. And one interesting thing there is, it's really good. It gets egos out of the way, because sometimes, me, I'm also with the background of chiropractic, it's easy to feel like, hey, this is the most important thing. Like, you got to get adjusted, right? But then if everybody feels that way, that's bad for the patient, right? Because they don't know what to do. So we have a priority system that I've developed that allows us to very objectively determine, when we make our recommendations, where we fall on that priority list. And then it becomes easy to kind of put recommendations from multiple providers together. And I can look at that list and I can say, okay, here's where I am and here's where everybody else is. And then I commit as a part of the team to supporting that, even if I'm not the top priority. So maybe I say, you know what, like, your neck's in bad shape, but your cardiovascular system, like, you could have a heart attack any day. So that's actually your top priority. And if need be, like, we're going to postpone adjustments to make sure that's addressed until, until things shuffle around on that priority list. That's tricky when you're the only one in practice, right? And it's like, well, I want to take care of this patient and you've got all these things.
Right.
But these are dynamics, like I said, where I think the system of healthcare is so important, not just the content.
Yeah, I think that's great. It's a great approach. And I think the patients have the best opportunity in that type of approach. Dialing into one of the areas that you have available, regenerative care, just picking one out. Why don't you share a little bit about your approach to regenerative care?
Oh, regenerative therapies are really exciting. This is, I think, if you take like kind of conventional orthopedics, and a lot of kind of the musculoskeletal, we'll call it musculoskeletal part of conventional medicine, but you put that in our paradigm, you're going to have a lot of regenerative therapy. I think of it kind of a couple different ways. Say, kind of a classic like knee problem, right?
Sure.
So me previously with a knee issue, I can adjust the knee. I can do a structural evaluation. I can look and see, okay, is their pelvis twisted up? Do they have an issue with the low back? Is there something creating a biomechanical stress on that knee?
Right.
Is there an anatomic, there's a lot I can do there. But if a house catches on fire, right, you have two things you need to do. You need to put the fire out. And then also you need to make that house livable again, which means, renovating that house. So maybe just by myself, I can put the fire out with that knee. But if they've had 10, 20 years of this constant wear and tear on that knee because of whatever it was, now there's damage inside that knee itself. So we're going to need to
taking hold.
Yeah. And we're going to need to use a regenerative. That's typically where we would use a regenerative therapy to help heal and repair that joint, so that not only is the problem resolved at a root level, but also, we've gotten them back to whole again, at least as much as we can. And we were typically going to use things like PRP, ozone, stem cells, or something of the sort in that joint, along with their nutrition and their functional medicine, and looking at their body holistically to do that.
So taking the knee as the example, you've got a lot of degenerative change going on in there. Maybe they've had a history of, torn ligaments, whether it's the ACL, PCL, medial collateral, wherever it may be.
Yeah.
And, the typical conventional approach is, hey, well, let's try some steroid injection, try to reduce the pain and inflammation. And if that doesn't work, hey, we're heading towards knee replacement or some type of surgery.
Right.
So in lieu of that, you're looking at the platelet-rich plasma and ozone and those types of things. And so kind of walk us through that a little bit. What's actually, the procedure and protocol for, that approach.
Yeah. Oh man. And this, I can talk forever about this stuff. So you might have to corral me here, but this kind of really brings us to another part of this system of healthcare, right?
Right.
Part of that is who we are beholden to. And I think in healthcare, a lot of times we've really sometimes unwittingly lost touch with the fact that we are beholden to the patient. Like our responsibility is with that person, not the insurance company, not our convenience, not something else. We really need to be just doing what's best for that patient. And unfortunately, these other kind of factors come in and it changes how we do healthcare. With that person, something like a knee problem, it's pretty amazing when you just say, okay, how do I properly escalate this situation rather than jumping straight into surgery? What can we do now? And what all does that take? And you find that actually it's typically a lot less than you would think. People are so used to like, oh, my knee's a mess. I'm going to have replacement surgery. I got to do pain management. I got to do this and this. It's this whole ordeal when really you can have something like PRP or ozone or stem cells. I mean, that's a quick, easy procedure. It's minimally invasive. It's very safe. The risk involved is practical. I mean, if you've ever had a B12 shot, it's practically the same risk, which is almost zero. And you're in and out, like you don't have any downtime. If you get PRP on that knee, you're not like bedridden for, a week or 2 or months. So those are very exciting in that way, because as the patient, you're thinking, you might be imagining, well, my knee's a mess and they said I've got, wear and tear and the meniscus is worn down and cartilage is gone and it's bone on bone.
Right.
But then you come in and we find out, well, actually, no, there's a lot of workable space there. This is something that we can do. And in 20 minutes, we can do a regenerative injection into that joint, get it healing and recovering. And you walk out of here and keep living your life.
So typically, doesn't take too many treatments with that type of therapy. That, what would be a typical protocol for a knee issue? Is it, a single appointment? Is it 2 or 3 injections, or is it, something that's spaced out over time?
Yeah. Well, I can tell you, I try and communicate in the perfect world scenario to patients, but I understand that that's not always doable. And also speaking of the system, I'm going to keep coming back to the system of healthcare. I think as doctors, we are not in the driver's seat. Like it's the patient's life. It's their choice. It's what they want to do. I need to describe to them what I think would be ideal. I need to talk about the implications of that. I need to tell them things that, what gaps there are about, potential things that I don't even know to tell them. And I need to be there to love them, whatever they decide to do. And if they need a plan B, but it's not ideal, it's my job to help with that. If they don't want to do anything, it's still my job to be there to support them. And I think conventional medicine tries to get in that driver's seat and say, we're going this way, whether you like it or not. And it's, if you don't like it, you jump out of the car sort of thing. And that's a horrible way of approaching things.
Right.
But that's the system of healthcare. We got to change that. So I'll tell you kind of what I would say, classically be a, kind of a perfect world scenario for a knee.
Sure.
And then, but we're always going to sit down with that patient and say, here's everything that would be perfect world scenario. Here's how it's prioritized. Here's who's involved. What do you want to do? Usually, like with a regenerative therapy, say we already covered the stuff I mentioned with the structural evaluation and all that, then it would really just depend on how much damage there is and how heavy duty we want to go with it. Sometimes people are thinking, well, I just want to jump in and do what's the most potent regenerative therapy I can do right away? Because I don't want to do this twice sort of thing. In which case we might use something like stem cells with PRP follow-ups. And that might be, you might have 3 to 5 PRP follow-ups after that over the course of months. But some people might say, it's been hurting me and I'm feeling great with the other stuff we're doing, but the joint still needs some help. So let's just put our toe in the water. Let's do kind of the first escalation, more natural, like easier thing. And we might say, okay, let's just do I shouldn't say just, these are very powerful therapies, right? It's not just PRP, but okay, let's do a PRP injection into this knee. And let me just go one step at a time, see how it feels. If I want some more, I'll do it. And that's, kind of another way of approaching it there too.
Yeah. And encouraging them on their own health advocacy to go along with what you're doing, I'm sure is part of your strategy and counsel.
Yeah. It's always trying to help them. It's my job to help them get the best care possible. And I have to reconcile the fact that may not be what I want.
I know.
but it's not about me. It's their life, And so like, there's definitely a point in practice, not to be heartless, where I had to stop caring what they chose.
Right.
It was just not a healthy relationship to have with anybody. I mean, imagine if you treated your spouse that way, like people relationships wouldn't last long, but then we think we can act that way to patients.
Yes.
And I think that's just a bad way of that's a bad system of healthcare there, even if you've got the best content possible.
Yeah. Yes. It took me a while because you have the passion, you care for your patients, you want to help them, you've got some good answers. It can be nutrition, posture, all those kinds of things. And the follow-up might not be what you had hoped for them,
Right.
And so for me personally, it took me a couple of years to kind of say, hey, you just got to give them the information, then, plant the seed, put a little bit of water on it, it'll grow at some point, and so I understand that. And I appreciate that. I think, the best thing we can do is offer good information along with the care that we give. Part of the hope that we have is that people, especially in this time that we're in, take a little bit of the fear away from the health scare, whatever it may be. It could be something like a knee degenerative change that they're nervous about a surgery, or it could be something like cancer, and it's a very significant stressor. So you try to give them the opportunity to be able to get through any of it. And I think your approach is, as I prepared for this interview, looks to be that you try to help people, live as if they're going to have a problem, whatever it may be. So maybe you could touch on that a little bit.
This is one of my favorite topics, I guess we could say. And I think it takes people a little while. I can explain it and people say, oh, that makes sense. But I think it takes a little while to really settle in for people on what this actually means. And for me, the way I think of it is to focus on the bottom gear. And so I actually picked this kind of principle up when I was running ultra marathons. And so these are long races. These are 100-mile foot races. And training for that is very unique in that you have to focus on the bottom gear. Like, that's actually your fast gear is your bottom gear, because we're talking about over a period of time, right? Once you get into a long enough period of time, you have to make sure that that things are sustainable. So if you are training for an ultra marathon, initially you might be doing a lot of walking. You have to do your training at a you have to keep it at a very low intensity, because you're training for duration. So you'll still do, I don't want to get too much in athletics necessarily, you'll still do interval training and sprints and that sort of thing, but the bulk of your training is focused on the bottom gear. It's how do I improve the speed that I can go all day long at? Yeah. And for most people, if you say you have to for 24 hours keep this pace up, for most people, it's going to be hard to even walk 24 hours. But when you look at people who are doing really well in ultra marathons, and people who, especially like the top tier athletes, what's happened is they have gotten that same point. So the way that you and I might feel walking, and our heart rate and the exertion level, for them, it's the exact same, but they're moving at a much faster pace. Right? The exertion, how they feel, think about that, all the same. They're just moving at a much faster pace. And so it looks otherworldly because they're running 8-7 minute miles or less for 50, 100 plus miles straight. But they are, again, the feeling is exactly the same. And I think in conventional medicine, even natural medicine, we tend to try and sprint a lot. That's how we approach things. But I think our paradigm actually lends itself more to focusing on the bottom gear, which is, what are we doing on a regular basis? What's our bare minimum? What's our low exertion output over a long period of time? And so if you kind of look at the opposite of this, so say we think of holidays, and when people kind of pull the ripcord on their health, people give themselves a lot of days off. And this admittedly isn't my own concept on this side, but people give themselves a lot of days off. And that could be, the holidays, but then that turns into Christmas and New Year's, it's kind of the same. So there's, a 2-week period there that they're giving themselves off. And then there's weekends, and then there's weddings, and then there's events and birthday parties. You add all that up, and pretty soon people have given themselves a free pass for a third of the year. And 4 months in a year is a lot of time to be making poor health choices. And if you expand that out over 10 years, I mean, in 10, 20, 30 years, well, now you've got 10 years worth of time where people have made all the wrong choices. And that's plenty of time to have things go wrong. That's plenty of time to develop cancer. That's plenty of time to develop other chronic degenerative illness. And so focusing on the bottom gear is kind of the opposite of that. It's saying, okay, every day, today might not seem like a lot. Like maybe today I don't have a list of health things I'm doing. I'm not like biohacking my entire day where like I got up and I hit the sauna and then I did the cold plunge and then I did this. And while I was brushing my teeth, I had the red light going. And while I was doing that, and like I got 10 therapies today. And like, that's a very sprint sort of approach. But really, if we just look like, okay, today, what's my bottom gear today? And for most people, brushing their teeth is part of their bottom gear. That's part of how they take care of themselves. And it may not seem like a lot, right? But most people have a very solid bottom gear that includes twice a day they brush their teeth. So what can we add to that? What can we do to build that up to get people looking like they're sprinting, but really they're running in their bottom gear because we built that up? Well, now you're not just brushing your teeth, but now you're also doing this other thing and this other thing. And the exertion level is the same. They're not stressed. It's not taxing them, but their bottom gear is carrying them further and further. I don't know if that kind of, if you're following me there, but that kind of is how I approach that concept.
Yeah, I'm going to throw in a little bit of my thought line on there. I'm going to utilize some of your thought line as I continue to work with my patients. One of the ideas I've tried to share with my patients is that they are exercising every moment of every day. And I think it's in that bottom gear kind of idea.
Right.
And in my conversations with patients, especially over the last 15 years, wasn't as much when I was younger because I wasn't paying attention to postures as I should have been, being from a chiropractic family. I mean, I always, train and work out and things of that nature. So my general, approach to postures is good, but I have to teach myself that same lesson every day, that we are exercising every moment. And if you don't like the gym and you don't ever like to do any exercises or anything at all, just do life with better posture, and you're going to be doing better than a lot of people that work out often. And then the rest of the day, they're not paying attention to their posture and they're having spinal problems down the road.
Right.
So I think that kind of fits into that paradigm that you're sharing.
Yeah, 100%. And I'm not talking compromise necessarily. I'm just talking long-term outcomes. So here's the conventional approach to nutrition. It's cut out all the sugar. It's stop doing this. Make sure your meat is all good quality. Make sure everything's organic. Like you start rattling off this like very high intensity sort of nutritional approach. And is all that good? Well, yes. But what would really be the long-term ideal? I would say perfect world scenario. If, refined sugar just didn't exist anymore. What if it just wasn't an option? Like that doesn't mean everything's perfect, but just imagine if refined sugar just didn't exist. And so for the next 40, 50, 60 years, somebody just never ingests a single grain of refined sugar. Like that's a very bottom gear thing. But if you consider the implications of that over 40 years, that's tremendously impactful. And so I think we need to be conscious of both. There's a time and a place for both. And trust me, we are very much involved with patients making changes at all levels. But I think that bottom gear, the application of that, whether it's posture throughout the day and how they're exercising, whether that's in their nutrition or their lifestyle habits, I think we can kind of help patients recognize like, okay, like it's not how much can I do right now in the short term, how much can I cram in immediately, but it's playing the long game. And if I can just maybe it takes me a month, right? But if I make just a small, very incremental improvement in that bottom gear, that's actually really, really powerful. Because as long as it's that bottom gear and it's now set in, over the long term, you get a compounding effect of that. And that's what we're after. Running ultra marathons, you seem like you're not doing anything, but it's time in the saddle. It's training and training. Pretty soon what you realize is like, oh, actually, like I'm at my walking intensity, but now I'm moving pretty quick. Like now, actually, instead of a 12-minute mile, now I'm running a 10-minute mile. And like, I can do this all day. The feeling there is amazing. And it really just, I think, changes the perspective. And I think if we can get that into healthcare a little bit more, I think we're gonna in the long term have better outcomes.
That's great. You touched on a little bit of the nutrition idea. I think, years ago, maybe 300 years ago, the average human consumed about 4 pounds of sugar. And now we're at about per year. And now we're at about 150 pounds. And
like a whole human worth of sugar.
Yeah. And that was a book I read by Dr. Mercola. I can't remember the exact title, but that was, so I'm sure it's more now. So specifically in your practice, I was going to ask you what is your nutritional approach just in general? I mean, you've kind of touched on it when we talk about sugar, but what are some of the methods and approaches that you give to the patients?
Yeah, we can come at this from a couple directions. There's the bottom gear approach where we kind of know for everybody, like your standards. So like refined sugar, that's, for across the board, that's everybody, like nobody needs that. And it's not necessarily helping anybody. But at the same time, like we have to recognize that nutrition is very specific to the individual. We live in this weird situation where it's like here in the United States, we're such a melting pot. You can't assume anything because it's like, 2 generations back, that person could have been on the other side of the planet and had been there for 3,000 years,
right?
As far as their ancestry goes. So they're going to have a completely different microbiome, a completely different palate, a completely different way that their body processes things. They've adapted a certain way. And then now it's like never before in history, we just kind of pick up and move across the planet to a totally different climate, a totally different access to foods, et cetera. And then here in the United States, it's like we're all together. So like, I can't just take 5 people on my street that all live together and, in the same place and have a very similar lifestyle and assume that our nutrition is the same. So when we approach somebody for nutrition, that's a part of practically everyone's care, whether, they've got a knee issue or whether they've got a gut issue or a depleted immune system, whatever that is, nutrition is going to be part of how we resolve that. And we're going to make sure that their bottom gear is being focused on. And then 2, we're going to try and get real specific on their personal needs as an individual. That might include functional testing. Will probably include some blood work. That's also going to be, a variety of, consultation and kind of digging in with a professional and then helping formulate, a plan as we best see it. It's also going to involve a regular relationship. So, one of the things that healthcare should be is very interactive. If it's conventional medicine, the less you go, the better, right? You can be proud of the fact that you've never had to go to the emergency room, but nobody's proud of the fact that they've never been to the dentist, right? Everybody cringes at the idea. Like if you say, I'm 40 years old, I've never been to the dentist, everybody's going to wonder, everybody's just going to cringe at the idea of what's going on in your mouth. So we have found more and more at Hansen Health Solutions that we actually continuously need to see our patients more and more regularly to really be successful. That doesn't mean that's a burden to patients, right? Some people are like, well, I don't want to have to, whatever. It just means like with nutrition, if I give somebody a nutritional program, how long is it, do you think, before they need some help with that, right? How long is it before they have a question? How long is it before they're wondering what to do? For most people, it's a matter of days. So why would I say, see you in 6 months? I mean, that doesn't help them the way that they need. So if somebody's doing great, I'm not going to force them to come in, right? We're not talking about that. But I think oftentimes people need more engagement with their healthcare team rather than less. And I think conventionally people kind of get postponed a lot, but in a real healthcare system, we need to be seeing people very regular. How often do you go to the gym? Well, 6 days a week. Okay, like that's really regular, right? And nobody balks at that because their paradigm is, more engagement is better. How often people brush their teeth and take care of their teeth. It should be the same when it comes to your healthcare team. Nobody should be excited about the fact that they aren't engaging with a real healthcare team. Everybody should be excited about the fact that they regularly see this team of individuals that helps them with their health.
Right. And you're establishing that relationship and, making the investment, to give them the best potential. And then they get the chance to engage, at the level that they want to engage at, ultimately, it sounds like, for what you're doing.
Yeah. And even if you're not working on something, there's a level of attrition with everybody, right? If you're on an island and there's no accountability, like usually people tend to get a little worse. Things get a little looser, things kind of fall apart some. So
Right.
how long are we going to wait until we check in and tighten things back up again?
Right.
That's important.
So you have a pretty strong wellness part of your practice approach.
Yeah, I mean, I don't know how we could define these words in every which way. They kind of get tossed out there. But yes, they're very much proactive, cause-focused approach to healthcare and being well.
Very good. Yeah, I like that approach. So you're seeing all types of patients, all types of demographics, acute care, chronic care, the 20-year-old, the 40-year-old, the 60-year-old, all of the various representations of life.
Yeah, and usually people are going to come in when something's wrong because that's what we're used to. But hopefully, as they interact with us, they catch kind of their mind opens up to a different way of doing things, and that changes as well.
Very good. So hormone balancing, I wanted to touch on that. What's going on with hormone balancing at your office?
Oh, yeah. I mean, that's another one. There's a lot you can do there. And it depends if we're talking, if this could be like adrenal hormones, this could be sex hormones, this could be natural, this could be a sort of like supplemental approach. But one of the things that I think helps people understand this, vitamin D is a hormone. So in a way, we're doing hormone therapy if we're optimizing vitamin D. And how do we do that? Well, usually we're going to try and modify lifestyle, and we're going to be supplementing. We're going to do blood work and check and see where that's at and make sure it's, optimized. But I think a lot of people misunderstand hormones in that they think, well, as I get older, my hormones decline. And I think what people need to do is start thinking of it as, as my hormones decline, I get older. And we can actually, we don't have to necessarily settle with the idea that, I'm a woman, I went through menopause, and now I just have to live life, void of the benefits of all these hormones, when these are life-saving, life-protecting molecules in the body that allow us to keep I don't want to just say optimized life, but allow us to keep a vibrant and productive and functional life. So one of the things I think about there, like everybody met Lana just now, but I'm a huge animal lover. I've always had dogs. And just think about the fact that, with animals, we spay neuter. Culturally, we spay and neuter like immediately. Most of these animals have never even had a single cycle. The males have never had a flush of testosterone course through their body. The females have never had, they've never had a single cycle. We just remove the sex organs. And what's insane to me is if you ask vets, veterinarians, most of them don't even think twice about the repercussions of that. But just imagine doing this to a human. Imagine a human, you try and take a male human and grow them and have them live their life without ever having any testosterone. It would be a miserable life. And they're going to be prone to a lot of degenerative problems, issues. Hormones help protect joints. So speaking of that knee patient, one of the things, if we really want to be comprehensive about this, we should look at how is everything going in your body that's typically taking care of that joint. Right. And, most dogs now, a lot of people are running into issues aside from dogs having diabetes and all that, right? They have a lot of issues where they're tearing up their ACLs, right? You have all these dogs who are trying to be active and they blow their joints out. It's like, well, how much of that is because this dog just never had any hormones to protect that joint to begin with? There's your $1 trillion idea if somebody wants to get into the natural bioidentical hormone replacement for dogs. That'd be a big one.
There you go. Hey, so I wanted to kind of touch a little bit on stimulating the immune system, especially in the times that we're in. What is your office? What are you doing to, help people navigate the viruses and the bugs and the seasonal and unseasonal things that are hitting us? And how are you helping people support their immune system?
Yeah, we're going to come at it from two directions. One, we're going to be boosting the body and its natural ability. And then two, we've got a variety of natural approaches that help get rid of the bad stuff. So for example, like with IV therapy, one of the things that's we see amazing results with is megadose vitamin C. And it's funny because I don't know how it is where you're at, but here in San Antonio, we've had a lot of kind of IV bars pop up where people
Okay.
can go get IVs for like hydration and whatnot. And they'll talk about how they can put, vitamins and stuff in there. But if you look at it, what they're getting is a very, very small dose of these things. It's kind of like, well, we'll give you a gram of vitamin C in this IV along with the hydration. And that's a very different thing than giving somebody what's clinically called a mega dose, or like a super dose of vitamin C. And that would be 25, 50, 75, 100 grams of vitamin C at a time. That's not something you can even get. You can't even consume that orally. It has to be done via IV for the body to even be able to handle it. But this has an amazing effect on the body. It's completely natural. It's more of a therapeutic dose. So we're approaching this much more clinically, and that's going to boost the body's immune system up, among other things, and just very, very potent coming at it from that side. But then on the IV therapy, we might switch over and we might say, okay, we ran some blood work, or we did some testing, or we looked at what's going on in your gut, and we see a high viral load. We see, overgrowth with this or that. And we see, that your immune system is fairly robust, but it's also just overwhelmed because you have so much of this other junk floating, so much for it to deal with. So we want to lower that as well. And something we might do there would be ozone with the UV light therapy. And that's extremely effective at crushing those, deactivating those viruses and bringing down that load that the body has to deal with. So one, we're boosting the body up. Two, we're taking the weight off the back. And this is where we really see people pull through with immune conditions.
That's awesome. There's so much going on in your office. We could go quite a bit further on this interview, but we're kind of getting close to wrapping up. I wanted to touch back a little bit on your experience with ultrathons. And I think you had a little bit of experience with the Olympics. Maybe just touch on that a little bit, and or anything else you'd like to share.
Oh, anything I'd like to share, man. Well, I appreciate it. To be clear, I didn't compete in the Olympics. I've always been athletic, and I really enjoy the kind of extreme stuff from running the ultra marathons. The last few years, I picked up gymnastics, and I'm like the most inflexible guy ever. So I appreciate that. It keeps me strong, but also it's a skill to develop, and it helps me get a little more flexible. But I was honored to be able to go to the 2012 and the 2016 Olympics, help take care of some of the athletes there. And man, we could talk a lot about that. So I don't want to get too philosophical. It's very interesting to take care of and be around people at that level. For me, the energy is absolutely amazing. And it's just the Olympics, if you haven't been, man, I was blown away by how great of an experience that was. But people think that Olympic athletes, people have a couple misconceptions there. One, people think that they just do more, right? And also they think that they're doing like secret things, right? They think that what they do is out of reach of, the common person. I shouldn't even say common. I'm somebody who's not an Olympic athlete, right?
Sure.
The reality is, okay, one, what you're looking at with these Olympic athletes is that bottom gear, right? Running at a very high rate. So you're walking, they're running a 5-minute mile, right? That's Olympic level, but it was the same things. They just committed to it, and they did it for as long as it took. And I think if we do the same, we can have those sorts of outcomes with our health. We can have Olympic level health. We just need to apply those same principles. And also, those people, they're not a full-time, I work out 12 hours a day approach. You'd actually be surprised at how, I don't want to say little, maybe that Olympic athlete works out, but you'd be surprised at what the whole program looks at and how relatively small amount of that is high intensity, really taxing work, and how much of that is their recovery and getting good sleep and maintaining proper stress levels, and really just making sure that when they work hard, it's effective and the most productive possible. And that when they're not working hard, that they're being as effective and productive as possible in other ways. And so I think that's one of the things I think about when I remember, my experience with the Olympics, and when I'm talking with patients, those same principles apply. And you'd be also surprised, to find that Olympic athletes aren't perfect with everything. I have talked to athletes that just won a gold medal and were eating pizza on a regular basis and just had no nutritional guidance in that way. So Can we still have great results and not be perfect? Yes, absolutely. Did that same athlete do better once we pulled that pizza out and put something else in? Yeah, absolutely they did. But, that's just something to consider there where, again, like that bottom gear, rather than thinking about here's all the things I'm not doing, we just think, okay, how do I build my bottom gear up? Here's things that are locked in, is a part of my lifestyle. It's not taking extra energy or intensity from me to pull that off, but I'm doing it and I'm going to be doing it forever. If the more of that sort of stuff that we do, the more of an Olympic athlete you are when it comes to whatever you're doing.
Well, that's a great place to kind of wrap this up. It's that long-term outlook, try to establish that rhythm of life and, try to hold on to it for a decade, 2 decades, 3 decades. And, and you can start at any time. That's the one thing I want to share as well. And I'm sure you share this. Patients that come in their 60s that just retired, that get it, that, hey, activity is still good. Many times at 70 or 75, especially if they ramp up that bottom gear a little bit, if I can use that term, at 75, they're doing better than they were at 65. Those that shut down a little bit at 65 when they retire, at 70, they're struggling. And that speaks to the body's ability to rebuild and repair itself. And if you give it good things, it's going to give you, the best opportunity to have quality of life. I always try to stress quality of life. Length of life, I think, is in so many ways out of our hands. But if you do well with quality of life, you get your best opportunity for length of life, if that makes sense. So I really appreciate what you've been sharing today. Any final thoughts? And where could one follow up to get a hold of you and maybe make an appointment, see what you're doing?
Yeah, we're here in San Antonio, kind of centrally located, which is great. The clinic name is Hansen Health Solutions. That's the website. You can find us on social media. I'm on social media as Dr. Clayton Hansen. That's Hansen with an E. And I got locked out of Facebook and got hacked and had to shut all that down. So I'm starting that up again. But pretty easy to find. Yeah, Hansen Health Solutions. And we are accepting new patients. In fact, I'm about to get into a nice new clinic here in about a month. So we're excited to have everybody come to a new facility that's really going to be, the latest iteration of everything I'm talking about. And I appreciate the time. It's been great to talk to you.
Yeah, well, have a blessed day. Great to talk to you and carry on the good work.
All right. Thank you so much.
You bet.